Well, thank you very much, Maria. I must say it's a great pleasure to be here, and thank you very much for joining us this afternoon. This webcast is part of a workshop today on the role of accreditation in enhancing quality and innovation in health professions education, and we've been having a robust discussion, rigorous debate, and it's been great fun. And I do want to thank the National Academies of Medicine and the Global Forum on Innovation in Health Professional Education for inviting me to be here. As you've heard, I'm going to talk about social accountability and accreditation, and I'm going to start by trying to clarify, or at least review, the meaning and intent of social accountability. Then I'm going to connect social accountability to accreditation, and then explore some practical ways in which schools can become socially accountable. First, though, I have no conflicts of interest to declare, just so you know. And now I'm going to move on to social accountability. So you can see on this slide, and this is the definition that was developed by the World Health Organization in 1995, you can see that social accountability of medical schools and really health profession schools is the obligation to direct education, research and service. That's all that the schools, all of the activities of the schools really, towards addressing priority health concerns of the community, region, nation that they have the mandate to serve. And that was 1995. Now it's more than 20 years later, and there have been many attempts to refine and improve that definition, but it really seems to have stood the test of time. So what about accreditation? Well, we spent a lot of today at this workshop discussing accreditation and the pros and cons and the place and connection to potential innovation. For right now, the question is accreditation a mechanism that would ensure a social accountability? And I would say the answer is yes, provided that the accreditation process is guided by those values: quality, equity, relevance, partnership, and cost effectiveness. And they are key principles really that go with social accountability. I should say that actually social accountability, there's a movement that's really spreading around the world, has spread around the world, to encourage a focus on social accountability in health professions education. And already the World Federation of Medical Education has included social accountability in its standards. WFME really provides a framework for accreditation standards rather than accrediting the schools directly itself. And actually in Canada, social accountability is now part of the standards, and I'll say a little more about that in a moment. But I do want to highlight that the World Health Organization's guidelines for transforming health workforce education in 2013 has a strong emphasis on social accountability, responding to the health needs of the communities. And next month at the World Health Assembly, there will be a motion, most likely will be a resolution that supports the World Health Organization Human Resources for Health Strategy to 2030, which again has the emphasis on social accountability. So in Canada, the Committee on Accreditation of Canadian Medical Schools last year actually adopted this element in the first standard for the accreditation of medical schools in Canada. So you can see it's in the standard that's about the institution, and it's about social accountability. And it says certainly that the institution should have a mission that addresses social accountability, but also more specifically the various elements of the education enterprise, the admissions, the curricular content, the types and locations of the educational experiences, and also be able to demonstrate specific outcomes. So this was only last year. So far, 2 schools in Canada have been considered using this element in this standard. So it's a little early to draw conclusions, but you can see that the process, or how the process, how social accreditation, social accountability it can be woven into the accreditation process. So in practice, how can we do this? Well, I'm from the Northern Ontario School of Medicine, as Maria said. I'm the Dean. We're a relatively new school in Canada. We're celebrating our 10th anniversary right now, and we're a founding member of the Training for Health Equity Network, or the NET. And as you can see from this slide, we have schools all around the world. In this country, the University of New Mexico is a member school of the NET. And the NET, it's a network, a global community of practice that has a focus. All of the schools, the institution is guided by social accountability. So to help kind of clarify when we say, well, this school's socially accountable, that's not, we have this slide, which, I mean, for each of these items, it's not one or the other. It's a spectrum, really, and it's where the school is on the spectrum towards the social accountability end. So whether, it's not that schools should stop focusing on managing disease, but certainly include health promotion, prevention, disease management, and not to leave learning in hospitals out completely, but certainly have the active involvement of communities and learning experiences for the students in the community setting. So that gives you a bit of a sense of how if you're trying to pin down, well, what are the key elements or items that you'd expect to see in a socially accountable medical school. To help schools to become socially accountable, the NET has developed an evaluation framework of social accountability, and you can see on this slide there are 4 key steps in that, and so it's assisting the school really to assess its own performance and to set guidelines or set targets, I guess, towards becoming more socially accountable. I want to also talk more specifically about community engagement, as I see community engagement really as a key mechanism for delivering on social accountability. This description of community engagement is taken from Northern Ontario School of Medicine. So in Northern Ontario, the communities are really interdependent partners with the school. We had quite a discussion yesterday about, well, how to really define more clearly community engagement, and terms like co-creation of the program, a sense of genuine collaboration between the community and the institution. And more than that, certainly for Northern Ontario School of Medicine, the community is actively involved, and the community contributes to the development, delivery and evaluation of all of the activities of the school. And when the students are in communities, specific communities, the communities help the students to really feel, and the students' families to really feel at home in the community. Of course, there's a future recruitment potential for the community in terms of this. Once they graduate, the student, their family might want to come back and practice in that setting. But more than that, the community actually enhances the learning experience for the students in a way that helps the students to appreciate the social determinants of health at the local level. The interaction between the school and community, of course, there's much more to it than that. It's not just about students or other learners in different health disciplines. It's also about research activities and really enhancing, building the capacity for the community. We did a study in Northern Ontario looking at the socio-economic impact of Northern Ontario School of Medicine, and showed that it's positive in both ways. The economic impact, a 2-for-1 multiplier effect. So for every dollar of taxpayers' money spent, there's $2 of new economic activity, and this effect is even in the smallest of the communities, and also a positive social impact as well. So the interdependent partnership, the community engagement, I think is a key to actually being successful in delivering on social accountability. So I'd like to invite you all to come to Northern Ontario next in June. We're holding a conference by the grand title of Icemen, stands for International Conference Community Engaged Medical Education in the North. And we put this conference on in partnership with Flinders University Australia and the Training for Health Equity Network. And this conference will really explore community engaged medical education in depth. We'll have 4 of the communities that are part of our network actually presenting how they contribute to and are part of Northern Ontario School of Medicine. It's going to be held in Sault Ste. Marie. There's actually a pre-conference conference on the move coming into Sault Ste. Marie. and I'd encourage you to come to that. We'll also have an Indigenous Health Research Gathering and our annual Northern Health Research Conference. So, and I'd encourage you actually to decide to come and join us today, because today is the deadline for the early bird registration for the Icemen conference. So there are some references here, and I expect you'll be able to access those after this webcast. And I just want to sort of draw this together. I have talked about social accountability and what it means. I've connected that to the accreditation process and given some examples of the practical issues for schools that are moving towards social accountability. In conclusion, I would say that including social accountability in accreditation has the potential to assist schools in developing a genuine focus on responding to the health needs of the people that we have the privilege to serve. Thank you.
Thank you very much, Roger. And to start the questions, I've got a question for each of the presenters today, but we did want to invite our webcast participants to send in by email. There should be an address that you'll see below the webcast player. You're welcome to send in those questions to the speakers, and those questions will be received after the meeting, and you'll be getting responses later. So please let us know if the questions are directed to one of the speakers or to the panel as a whole. So Roger, you talked about the link between social accountability and accreditation, and I understand that recently the Educational Commission for Foreign Medical Graduates has decided to require by 2023 that all international medical graduates seeking to work in the US must graduate from an accredited program. So your thoughts on what that means, what that decision means in light of your comments related to social accountability and community engagement?
Right. Well, I would say that this creates some sense of urgency, really, for social accountability to be woven into the accreditation standards of medical schools around the world. For a long time, the ECFMG has been assessing the credentials of medical graduates from outside the United States as to whether they're suitable to work as doctors in this country. But now, or at least from 2023, there will be a requirement that those doctors have graduated from a school that's accredited. And so I would say the concern is that, or maybe it's an opportunity, is that accreditation standards where the graduates actually come out with a mindset of focusing on community health needs and responding to that's potentially a different kind of graduate from the graduates that might come from other schools. And to kind of put this in perspective, I draw your attention, just actually about a month ago, I published a paper in the annual reviews of public health, and the paper was about rural health access and policy in developing countries. And in the paper, I actually make the case that we need to have an alternative international standard. So at the moment, the international standard for graduates from medicine, nursing, other health professions is that the graduates have the skill and the potential to become staff in the teaching hospitals of North America and Europe. And that's actually what they do. So in a sense, their degree is a passport out of the country, and so it's a double loss, especially from graduates from public medical schools in those countries, because the public has invested in these individuals and then they leave the country. What we need is an alternative international standard, which is that the graduates have the skills and the commitment to provide care where it's most needed in the underserved populations of their own country. And I would say there's an urgency with that international standard is consistent with social accountability, and so we need to redouble our efforts really to ensure that social accountability is built into the standards for accreditation of medical schools.
Thank you, Roger. So very much a call to action for those of us that are involved in the accreditation movement.